Do all the good you can, by all the means you can, in all the ways you can, in all the places you can, at all the times you can, to all the people you can, as long as ever you can. Not every story has a happy ending, but ours does, thousands of them, because our story is their story. The tales often begin humbly, with a need for assistance and care, with a gap in support, medical care or assistance that's too big to overcome. Like others with a limited and intermittent income, Sharonda is often faced with tough choices, especially when she needs medical attention. So she turns to the Methodist Healthcare Ministries Wesley Health and Wellness Center.
People have to choose between medicine, doctors, or food, or rent. And I don't think anybody should have to make that choice. That's a life or death choice. Wesley's not like these clinics out there. They have a different vibe. They have a different focus. It's not about them, and bringing in how many patients. It's about, you need help, we need to help you. And if we can't, we will try to find you help wherever you need it.
Methodist Healthcare Ministries, chartered by the United Methodist Church, is a critical first point of contact for those in need throughout South Texas. Now in our 17th year of service, we anticipate taking action on 797,000 client requests in 2012, spending nearly $72 million on direct counseling care, parenting programs, health services and education, dental care, and more. Profits from our one-half ownership in the Methodist healthcare system fund our outreach, providing life-saving medical services for people like Mario and Maria, people who have jobs but not health insurance and rely on our Wesley Health and Wellness Center for affordable care.
I had some pain, so I went to a doctor there and sent me to the hospital. They found out I had cancer, and it got me a surprise, and he sent me to a hospital and they helped me. Now I'm cancer-free. They took my kidney out.
We've been with a lot of clinics, a lot of doctors, but this makes a big difference in our lives. He wouldn't be sitting here next to me if it wasn't for them. And thank God with them, and they were blessed with them because they've done a lot in our lives. Not just changed our lives, but changed our families because we still have him.
Our storyline is broader than healthcare. MHM is changing family histories through parenting classes, after-school care, and community programs that teach lessons about living life in positive ways. As a child, Ernesto became part of a neighborhood mariachi group that met at MHM's Wesley Health and Wellness Center. Over the years, his family came to the center for day-to-day help, especially after his father's disability made it harder to make ends meet. Today, Ernesto is a music education major at UTSA and a volunteer at Wesley.
A lot of the managers that have been through the Wesley, they've all helped me. They've all showed me what it is to actually grow up and just to be a leader. If it wasn't for any of those people, I probably wouldn't be here right now. There's this one worker that told me about this one way to pay for college, and that's what's helping me get through college right now. It pretty much pays all of my tuition off. I'm just extremely grateful for what everyone that's been part of Wesley has done for me, and I just say to keep the good work.
Like hundreds of moms, dads, grandparents, and guardians in South Texas, Maria gets parenting support and education through our MELD program. But her situation is unusual, and one that others might find overwhelming. Maria cares for 9 children in a range of ages, some biologically hers, some adopted, and some living with her in foster care. And of the 9 children, 7 have special needs.
There was such a thirst for me as an individual and as a family with children with disabilities, and it was just what we needed, just what I needed. At the church that we go to, we just started a disabilities, a CCD class for kids. And from there, we've gotten 2 different families to go to our group. And just letting them know there's something out there. They've been a part of our life for a while now, and I just can't I can't imagine not having our group.
A chapter of Rebecca's life story features the Wesley nurses, who turned an incredibly tough time of profound loss into a fond memory of giving. It was Christmas when Rebecca's son Theodore faced the final days in his losing battle with cancer. With 2 young children and no presents under the tree, he and Rebecca agreed to leave everything in God's hands and to ask the Wesley nurse who had already comforted her for additional help.
We were expecting 1 lady or 2 maybe, but when they showed up at my son's house, there was 14 of them. And they kept coming in and coming in and coming in through his door because they asked us if they could come in, and we said yes. And he was just amazed with all of them. They did so much. They all had their hands full of gifts for the kids, each one of them. And his, well, like I say, his tree was empty and it got full. And it brought tears to his eyes. And he was very appreciative for that. This is my son and his family. And the Wesley nurses don't know how they touched their hearts. My son's heart and his wife and the children. They made a big difference at Christmas. It was wonderful. And I just want to thank them for that.
Our story and theirs continues to unfold every day in the communities we serve, helping others by serving in His name.
You know the saying, it takes a village to raise a child. Well, Wesley's my village.
If it wasn't for the clinic, I guess a lot of people would be suffering right now. And I'm grateful for them, for the clinic.
Don't ever stop doing what you're doing because you're changing a lot of people's lives.